Okay, good afternoon, ladies. Okay, today we are going to demonstrate on how we examine the mother's breasts. I have a trolley here which I have prepared. On my trolley I have some solution, that is Savlon. It is an antiseptic for cleaning the mother's armpit. I have some swabs for cleaning her armpit. I have a small tray with some small towels for helping me to dry my hands because I have to wash my hands. On the bottom shelf, I have a tray with some drawer sheets for covering my mother, because when I'm examining, I shouldn't expose some parts which I'm not examining. I have a kidney disc for received swabs, for used swabs, to receive used swabs. I have some lotion in a small jerry can in case I need some, in a small whatever, yes, in case I need some more lotion. Then I have some disposable gloves for cleaning my mother's armpit. So I have to wash my hands first. These small towels. And after drying them, I've already prepared my mother, because you found her prepared. I've prepared her in her bed, and thank you. So we are going to remove our gown to expose both breasts at the same time. Can keep our gown aside here. Then when we are examining the breasts of these mothers, we first tell the lady to raise her hands and put them on her head. Madam, I assist her to put the hands on her head. This action she has done helps us to see how her breathing patterns are, whether the breathing patterns are normal or not. For her, as per now, our breathing patterns are normal. She's breathing well and has no problem. Remember, this is the mother who is pregnant. Let's assume the breathing patterns are normal, and this one also helps us. Put your hands down to detect whether there are some deep seated masses. When you do like this, the breasts are well exposed like this, and you can see any raised eminence in case there is any deep-seated mass in the breast, like how you note here in this breast, there is a raised area which is there. So in case you find any raised area in the breast of the mother who is pregnant, you suspect that maybe there is something inside. So that's why you put our hands in the groins like this. So we are continuing with our inspection, that they are now two on the mother, because a mother is supposed to have two breasts, so her breasts are enlarged like that of a pregnant mother. We talk about a word like, because you never know, someone can be having a breast which is enlarged, but when she's not pregnant, that's why we said that we are expecting her to be pregnant, because we can't be sure. So we say her breasts are enlarged like that of a pregnant mother. The shape is purple shaped. The skin, signs of pregnancy are present. The primary areola is darkened, secondary areola is formed. Usually when I talk about the primary areola, I mean this part of the breast. This primary areola is this darkened part, but when someone is pregnant, it becomes darkened. And when it darkens, there's another area which is just next to the primary areola, whereby the secondary areola forms, it becomes lighter. So you can see it around the primary areola like this. So when you examine the breast of any lady, and you find these two marks, the primary areola when it's darkened and the secondary areola is formed, you suspect her to be pregnant. It is one of the signs of pregnancy. Then for the other signs, we see usually there are some Montgomery tubercles, they are raised eminences here in the areola. So they are raised like this. Those are also signs of pregnancy because they can't be raised unless someone is pregnant. Then there are mothers who have strigraviderums. The strigraviderums are some like scars. They usually, because the breast enlarges, the skin starts cutting itself like this and forms some scars, which are called strigraviderum. They come when she's pregnant. In most cases, when they occur on some mothers, they remain there. Even if she delivers, those strigraviderums remain on the breast. So you can find a mother who had a nice breast before becoming pregnant. After delivery, you find her breast when she's breastfeeding, when she has some little scars, and by the time she finishes breastfeeding, the whole breast is full of what? Strigraviderum. So those are signs of what? Of pregnancy. Then also we have some raised blood vessels. Some raised blood vessels, they can become, and the blood vessels can become raised like this, and you also see them on with your naked eyes on inspection when you are when you are standing on the other side. I came near because I wanted to explain to you so that you can understand what I mean. But we are supposed to inspect when you are on the bottom of the bed. Okay. So in this case, this mother's breast, according to the signs of pregnancy, those are the most signs which are usually we look for in pregnancy. Then when we are coming to the nipple, we look at the nipple and see whether the nipple is well protruded. It protracts. As you see it, this one is a bit long compared to the other parts of the skin. So it is protracted like this, which shows that this breast can manage to breastfeed the baby. Then even we look for the color, the readiness, whether there is any readiness, whether there is any dimples, whether there is a flatness of the nipple, whether there is the nipple is inverted, because those are the signs which show that the mother won't manage to breastfeed. For the readiness, it may indicate that maybe there is infection in the breast. Sometimes the color of the skin can turn to be orange. There is a discoloration, and you can find that the skin has some sort of orange depressions. That indicates that maybe there is an abnormality in the breast. Okay. So from there, after the inspection, we go on palpation. For the palpation, so I cover the mother like this, her back, because it's not supposed to be exposed. Okay. Then I'm going to clean my mother. I'm going to clean our mother's armpit. This is not a sterile procedure, so we use these disposable gloves. Okay. Mama, let's clean our armpit. I clean once and discard. Then I dry. Then I clean also the other part, and then I dry it also. So we have already cleaned our mothers. So I remove this glass because there's no need of using them on examination. I cover the mother, the area which I'm not going to examine at that particular time. So we are not supposed to expose this mother. We cover this part which we are not going to examine, and we open the one which we are going to examine. So you leave this one open, and this one is already covered. Mama, extend this way a bit. So here the mother is in a position where I reach her properly. Let her put her arms here in there. So we are going to start with the farthest breast. We support the breast with our left hand like this, as you see. So let me first rub the hands and then support the breast like this. Then we examine the axilla first, using this part, these fingers, but the middle of it. So we examine the fingers for enlarged glands and the axillary space down to find out whether there's enlarged glands. We come down clockwise, palpating clockwise. You palpate clockwise like this. You palpate, you palpate, you palpate. You palpate all around up to the nipple. Then you palpate upwards, like this, like this, like this, like this, like this. Even here, to confirm that there are no enlarged masses in the breast. Then afterwards, you press the breast, hold this hand, the left hand, let it be supporting the what? The back, and this one presses the breast towards the mother's chest to confirm whether there are no deep masses which are stayed where in the breasts. So in a normal mother who is pregnant and has no problem, her breast is always normal without any masses which are felt. After that, you go to the nipple using these two fingers. You go to the nipple and pull it outside, that is to see the protraction, whether it can manage to breastfeed the baby. And you express to see whether there is some colostrum which is coming, because this breast is supposed to be having some colostrum in the preparation of the coming baby. So when you finish this side, we examine the second breast. So we use this same grow sheet to cover this part which I have already done what? Which I have already examined. Now, still in the same way, we use this arm, the left arm, to support this breast. And we examine the axilla plus the axillary space down here and this area. Then we still palpate clockwise, like this. You palpate deep clockwise to find out whether there is any mass which is in the breast. Have you seen? Examine all over the breast up to when you reach at the what? At the nipple. Have you seen? Up the nipple. Then at the same time, try to use the same hand to support the chest, and this one to press towards the breast to feel for the deep steady masses which may be in the breast. And also at the same time, use those two fingers to pull on the nipple to confirm that the nipple is well protracted, and also to feel whether to express colostrum to see whether the breast is also ready for breastfeeding. That's how we examine the breasts of the mother. After examining, explain the mother what you have found out, Mama, that the breasts are okay, they have no problem. There is no any mass which we have felt, and I hope you are going to be okay after delivery. I hope you will manage to breastfeed your baby well. You have to explain to her so that she can understand the findings of her breasts, okay? Thereafter, we go and wash our hands. Thank you so much. You dry. We have to write the findings of the what? Of the mother. We write in our mother's file. Then after writing in the file that she'll send her to the pharmacy, because now we have already done our part. We send her to the pharmacy to get some, because she's pregnant, to get some routine medicine like F4, Fancida, according to what she's supposed to get at that particular time, and you give her a return date. Mommy, we are going to come back after 1 month to the clinic. You have no problem. They have examined your abdomen is okay, the breasts are okay, we are okay, okay? But you continue taking the medicines as they are going to be, as they have written, because they are going to give you those medicines in the pharmacy there, they are free of charge. Don't worry, you are not going to pay for them. Oh, you're welcome.